Welcome back to the Parkinson's Doctor channel here on YouTube. This is Dr. Amor Rodriguez, Parkinson's disease specialist and neurologist in Orlando, Florida, with the Neurology One Clinic. And today, before I begin, I want to say thank you to those of you that have subscribed to the YouTube channel. I really appreciate that, number one, you subscribe, and I appreciate when you make comments and when you ask questions, because it will help me understand better the kind of things that you all would like to know, so I can prepare more information for future videos. Before I begin, I want to remind you that the videos are for information only. This is for you to understand better Parkinson's disease, and they should not be regarded as medical advice. I always say that you should speak with your doctor and have the conversation about probably some of the things that you hear on the videos to see if they in fact may apply to you. Today I will be speaking about deep brain stimulation surgery, and once again I am coming back to DBS because it is a very common question in my clinic. I do see a lot of people with advanced Parkinson's disease, and they want to know if DBS may be a good option for them. So I will give you a very brief explanation in a very short format, but it will help you understand who is the ideal candidate, who is the best candidate for DBS surgery. So who is that ideal candidate for DBS? So in first place, we're speaking about a patient that must be diagnosed with idiopathic Parkinson's disease. And we had conversations before when we spoke about Parkinson's disease, and then we spoke about atypical Parkinson's or secondary Parkinsonism or a Parkinson's plus syndrome. So those cases are not what we consider idiopathic Parkinson's disease. The patient with idiopathic Parkinson's disease typically will demonstrate a robust benefit to levodopa. So they will take the carbidopa, levodopa, and they are able to tell, wow, I really feel like this medication is helping me. However, the main problem that they have is that, number one, the medication is not lasting long enough. That will be situation number one. And, you probably would identify with the fact that some patients, when they are diagnosed with Parkinson's disease, they begin on carbidopa, levodopa, 25-100, and they are taking one tablet twice a day sometimes. Most time they are taking it 3 times a day. And as time is passing by, and we're talking months to years, they have to increase to 1.5 tablets 3 times a day, then might have to take it 4 times a day, and then 5 times a day. And what happens is that most times people do not feel the benefit of the medication lasting until the next dosage. So they will take the medication at 8 a.m. and the next dose is at noon. So by 11 a.m. or 11:15, they feel that the medication is running short. They might start having some tremors, shuffling of gait, trouble walking, or some other symptoms associated with Parkinson's disease. So this is what we call wearing off. So even after adjusting the medication or even adding some other medicines to their regimen, they continue wearing off. They find this wearing off to be very bothersome, and your doctor has already tried to optimize your medicines, and even doing so does not seem to be helping a lot. So this is one of the cases where we begin thinking about DBS surgery. However, if you take levodopa and you don't find any benefit whatsoever, the suspicion in that case is that you might have a secondary Parkinsonism. Obviously, that is not the only criteria. You need to speak with your doctor, make sure that you're taking the right dose of the medication, make sure that we're looking at the right symptoms that are expected to improve with the medication before we say that you either have idiopathic Parkinson's disease or not. But the next thing is that people must respond to levodopa. So they need to show that benefit. And even before undergoing DBS surgery, one of the most common exercises that we do in the clinic is something that we call an on and off evaluation. So we ask our patients to come to the clinic in the off medication state. And by this, I mean at least 12 hours where they have not taken any of their Parkinson's disease medicine. So we want to see them when they are in the full off state, that they are clear from the medication. We do an evaluation at that time. And then after that, they will take the medicines in the clinic, and we are going to reassess the patient after an hour, hour and a half, 45 minutes. It depends on how long it takes for the medication for the medicine to start working on that particular patient, and then we're going to reassess again. So we're going to compare the before and after the medicine, and that will be quite helpful. Number one, making the determination whether in fact you are responding very well to levodopa. But number two, we see what are the symptoms that tend to improve with levodopa, because that is a good predictor about what kind of benefit you can expect from DBS surgery. So this is probably the most important part, and that is why before you undergo DBS surgery, I always ask patients and recommend to see a movement disorder specialist. This is what we do on a daily basis. We will prepare you to do this evaluation very well. So when you go for DBS surgery, you will have a better understanding about what you are going to expect. If you don't go through this process, then you might not be completely clear about what could happen after you have the deep brain stimulation surgery. Then the next step is this. The patient should not be demented. So dementia will be a contraindication to DBS surgery, and the reason is that typically DBS, because it is an invasive procedure in the brain, it actually might exacerbate the dementia symptoms, right? So one of the very important steps before DBS surgery is to do a neuropsychological evaluation. This is just not a mini mental exam or a MOCA exam, as we do frequently as a screening in the clinic, but this is actually seeing a specialist that all they do is this very deep and comprehensive assessment to make sure that we're looking into every aspect of your cognitive function, and we might be able to predict whether there is a risk of causing an exacerbation after DBS surgery. So this is, once again, this is very important, and we should not be cutting any corners, especially when we speak about cognition before having deep brain stimulation surgery. Then the next step is understand expectations very well. And this is where a lot of patients might have some issues, right? So obviously, I will expect that many people having DBS surgery, they would like to feel like before they had Parkinson's disease, right? And I have to say that some people might respond very well to DBS surgery, and they have these dramatic benefits, right? But that doesn't happen to everybody. Nonetheless, it doesn't mean that other people are not going to have any benefit. So I always like to make sure that people understand what are the things that we expect to improve. So in first place, tremors respond very well to deep brain stimulation surgery, and it might be actually the most dramatic thing that improves with DBS, right? And we see it right away. The patient has deep brain stimulation surgery. We do the first programming session, and quite frequently we're able to suppress the tremor 70, 80, even 90% in some cases. So DBS surgery is very useful when we speak about tremor control, especially for those patients with what we call a medication refractory tremor, which is a tremor that is not getting any better even after taking high dosages of the medicine. Slowness is another symptom that is expected to improve with DBS surgery. Stiffness, rigidity, also is expected to improve with deep brain stimulation surgery. However, one of the symptoms that we cannot guarantee that is going to get better with DBS surgery is freezing of gait, right? The difficulty walking that happens to some people that have Parkinson's disease, and sometimes even adjusting the medicines will not improve their freezing of gait, and surgery might not be useful either to improve those symptoms. And the problem is that sometimes people decide to undergo deep brain stimulation surgery in the hopes that it is going to improve the freezing of gait, and the reality is that while it could happen to some people, because we see this happening, but it will not happen to everyone, and people need to understand, because if we improve the tremors, if we improve the stiffness and the slowness, but the patient continues with the freezing of gait, then the surgery will be a failure, right? It's not going to have the benefit that they are looking for. Then the other thing is that people must be willing to undergo multiple programming sections. So what that means is that once you have the DBS surgery, you will have to go back to your doctor. There will be a programming session trying to make sure that the device is working at the right setting, the right parameter. Obviously, the surgeons will try to put these devices in the right place, but sometimes if they're not in the sweet spot, as we call it, there might be a need to do multiple sessions of programming to find just the right setting. The good thing is that we have fantastic devices at this time. I think that the last 2 to 3 years have just provided great improvement in the technology that we're using for deep brain stimulation surgery. I feel a lot more comfortable even offering DBS to patients these days, because with the directional devices and the range of settings that we're able to reach with these new devices is just amazing. So don't disqualify DBS as a possible therapeutic option for you. It is a very useful therapy. Many people are going to benefit from it. This is not a last resort option, right? This is for people that are in the moderate stages of Parkinson's disease. We want them to continue active. And yes, it requires a brain surgery. However, the technology that we have today has improved the accuracy that we obtain when we're doing these surgeries. All we have to make sure is that, number one, you have idiopathic Parkinson's disease. Number two, that the symptoms that you want to see improving actually can improve with the DBS surgery. And number three is for you to understand that sometimes it will take multiple sessions. You should go and have a conversation with your doctor because sometimes it just does not happen overnight, right? It might take a month or two for us to get it right. We even tell some people that it might take even 6 months for us to get it right. So it is a good option once away. Once again, the batteries are rechargeable now. They last a really long time. So once again, this is a fantastic option. So any questions that you might have or any comment, please do not hesitate to comment on the video. I'll do my best at least once a week to go in and answer some of these comments, some of these questions for you to understand this better, or it actually might lead to do another video, right? So please go ahead and continue commenting again and continue subscribing to the channel. I really appreciate it. I appreciate your comments again, and I look forward to the next video. Thank you.